I feel hope is really the key to preventing suicide and saving lives.
Welcome to another episode of The Force for Good. I'm Rick Ertzma. I am the Senior Mental Health Advisor with the Miller-Dwan Foundation and with Archimind. Today, I'm excited to have Chrissy Barnard join me. Chrissy and I have crossed paths in many, many ways over the course of the years, and most recently with cohort 1 of our PM Plus training, which has now been over a year ago. So what I'd like to do is introduce Chrissy. Thank you for joining us today.
Thank you.
It's good to have you here.
Thanks.
You have so many experiences. Most recently, we did some work together with Hope Haven, which we'll get to gradually. But how about if we start with you giving a brief introduction of yourself, your background, information that you'd like to share?
Sure. So I'm Chrissy Barnard. I'm a person with lived experience. I've struggled with my mental health most of my life, and which really took a down spiral when I was in college.
Mhm.
And it led to multiple hospitalizations, and then which one of them led to a commitment in the state hospital. I lost my job, my house, my fiance, my pets, and everything.
Oh,
And after 6 months of that, I came back to the Twin Ports and started my life over. And I found DBT and a psychiatrist and peer support.
nice.
And that really helped me on my road to recovery. And since that time, I've done many different things. I've joined many
That's an
councils.
understatement, Chrissy.
Yeah.
Yeah.
I've joined many councils and the Wisconsin Council for Mental Health and was appointed by Governor Evers to be the peer representative for Northern Wisconsin. And then I'm on the Recovery Implementation Task Force Committee. I joined NAMI, and I'm now currently the executive director of NAMI Lake Superior, South Shore, and Hope Haven Peer Run Respite.
Okay, let's break all of that down just a little bit because that's a lot of stuff. So, peer support, certified peer support specialist.
Mhm.
For our listeners, can you explain a little bit about what that even means?
Yeah, so in Wisconsin, it's someone with lived experience who attends like a 48-hour training,
Okay.
and then they learn to walk that path with someone and provide them not only like tools like coping skills and things like that, but also provide them support and validation, and then give them resources and lead by example.
Okay. So when you talk about lived experience, the lived experience really is specific for you is about lived experience with mental health struggles,
Yes.
right? And there's a whole network of certified peer support
Yep.
specialists?
Across the country, there's many in every state.
Okay. So it's not anything that's just unique to Wisconsin. Certified peer support specialists are basically nationwide.
Everywhere. Yeah.
And are you connected with the national network, or is there interaction?
I'm connected with NAMI at the national level, and they're talking about a national certification for peer support specialists,
Okay.
and that's something I would like to do eventually.
And so you think about from the beginning of mental health struggles, all of your lived experience, how does that help you be such an incredible certified peer support specialist? And how does that help with NAMI? I mean, you bring so much richness to every interaction that you have with people. It's incredible, um, and I think it's really impactful.
Yeah, so I feel like my lived experience helps bring not only that connection that I understand I've been there, I've been to the bottom, I know what it's like, but I also can give that hope that recovery is possible.
Right.
And I think that really makes a large difference for people knowing and that I can understand
Sure.
and lead by example and give them that hope.
And so, as a peer support specialist, is part of that role sharing that you have lived experience?
Oh, yes, definitely
Okay.
sharing my own experience. And I can be like, well, I understand how you may feel about that. And what's worked for me is this. It may not work for you, but it's something
Oh,
you may want to try.
okay. So from certified peer support specialist, then connected to NAMI.
Hmm.
NAMI is,
The National Alliance on Mental Illness.
okay. And for our listeners, that might be something that is absolutely foreign. So can you talk
Okay.
about that just a little
Yeah,
bit?
so NAMI is the nation's largest grassroots mental health organization, and their mission is to provide support, advocacy, education, and public awareness for all people affected by mental health. So it is everybody from family members to providers to peers to everybody in between, law enforcement and everybody in the
Wow.
community. So,
Okay. And the mission for you specifically as the executive director, right?
mhm.
You're the executive director on top of everything else that you do. What does that involve? Tell me more about that.
So I see the operations of the organization and Hope Haven Peer Run Respite.
Okay.
So I help with all the programming, membership, finances, strategic planning, all that stuff.
And somehow there's a tie into Governor Evers. Is it via NAMI? Is it, I mean,
I'm not sure. I just said I do all these things and and then somehow my name got passed along to his office and then they said, "Hey, why don't you be the peer representative for Northern Wisconsin?" And then when I joined the council, right away they said, "What are your interests?" And I said, "Well, adult mental health."
yep.
And then they said, "Well, would you be interested in being the co-chair for the Adult Access and Quality Committee?" And I said, "Absolutely." And then, of course, then they reappointed me to do that co-chair and appointed me to the executive committee and then reappointed me to the council too.
And that council, what's the work of that council?
Well, that council helps provide, shall we say, advice and recommendations to the governor's office and legislators and Department of Health and Human Services.
Okay. I've seen pictures of you with Governor Evers. I've seen pictures of you with NAMI people. And somehow you have this way of networking in so many different places, and all of these dots are incredibly powerfully connected.
Mhm.
So how often are you involved with Wisconsin legislature?
Those meetings meet every month for the subcommittee, and then like every other month was the council meetings. And then
Okay.
I would also attend Action on the Square for NAMI, Wisconsin in Madison. And then I'm constantly talking to representatives like appointed representatives like Angela Stroud and Senator Quinn's office and people like that. I frequently have contact with them as well.
All as an advocate for mental health.
Exactly.
And so all of that work, the thread that holds all of that together is from lived experience to hope and recovery
Hmm.
to now advocacy.
Exactly.
You're like the Energizer Bunny. You just keep going. And so Hope Haven is also now in this network. And can you talk a bit about Hope Haven? Because the Miller-Dwan Foundation, of course, has been involved with Hope Haven as well. So if you could talk just a little bit about Hope Haven.
Yeah, so Hope Haven is a place where people can get peer support and resources and information for their struggles with mental health and or co-occurring or substance use disorders.
Okay.
And then they can come and stay the night, or they can get support over the phone, or they can just drop in and
Okay.
get information and support that way.
And so not not a crisis intervention program.
It's not crisis. No,
Okay.
it's if they're distressed and having increases in their symptoms.
Okay. So if somebody are a Wisconsin citizen, are they
Wisconsin
okay.
residents
Okay.
is because that's what the state prefers.
Sure. Sure.
But we get phone calls from all over, including Minnesota,
And how long has Hope Haven been open?
since July.
Okay.
And we've received over 2,000 phone calls already.
2,000 phone calls since July
July.
of this year.
Yep.
And was that right from the very beginning? I mean, once people knew that the resource was there, how did this how did it start? I mean, it was like 10 or 15 phone calls and then, or is it just been a steady increase
It's been leaps and bounds, like a 200 plus month over month additions
just to the warm line?
just to the warm line.
And then numbers of people who actually come.
Yeah, so we've had like 64 drop-in guests just from July to October. And we've had 74 overnight stays. With one guest we removed because it skews our data because he was with us for 5 weeks.
Got it. Okay, so it's really kind of a short term.
Yeah.
Okay. Um, I'm having some difficulty. I really would like to talk to a peer support specialist. I could just drop in. Or I could drop in and I might need a place that I can stay overnight.
hmm Typically, people stay 2 days
Okay.
on average, but then they can come back over and over, up to 7 nights in a 90-day period.
And and the name Hope Haven, where
Yes.
did that come from?
Well, part of that was my inspiration because I feel hope is really the key to preventing suicide and
Y-
saving lives.
Yes, I agree. And what's striking to me about Hope Haven and the Miller-Dwan Foundation is this whole initiative that the Miller-Dwan Foundation started 3 years ago called Hope X.
hmm
How do we multiply healing? How do we multiply the ways in which we can help? So Hope X, Hope Haven, and then Chrissy shows up and you were willing to be a PM Plus, our Problem Management Plus program. You're willing to be, you went through cohort number 1, I believe,
Yes.
as a PM Plus helper.
hmm
Tell me how that fits in with everything else that you're doing.
Yeah. So, well, I was really interested in PM Plus because I feel like boots on the ground is really important to getting the support that people need.
Right.
And as a peer support specialist, I kind of feel like sometimes that's what we are, is the boots on the ground.
You are the boots on the ground. I totally
So,
agree.
for me, I felt like it was a natural fit and a natural transition. So, for me, it was really important to get involved with it from the get-go. So, I was like, sign me up
And you signed up for PM Plus when you were still at
to
Indigo.
go. Yep.
So how about tell our listeners about Indigo? What is Indigo?
Yeah, so Indigo is a place that provides support and services for people to remain independently living in their homes and for people who struggle with mental health concerns and other disabilities.
Are you still a part of Indigo?
Only until February.
There you go. Okay, so if one thing comes off your plate, it's probably because something else is going to go on your plate. So so tell our listeners about your experience with PM Plus. What has it been like? Have you had clients?
Yep. So, well, going through the learning experience was really interesting because the 12 weeks every week for a while, that was kind of challenging. But
That was challenging.
once you get through it, then it's kind of fun. I've had a number of clients that I've really enjoyed working with, both young, old, and in the middle.
Yeah.
And it's fun watching people change and when things come together and it's like the light bulb goes off.
And for PM Plus, it's a 5 session intervention in which we help clients manage stress, manage problems, uh, get out of their inactivity cycle, get going, keep doing, strengthening social supports, and then how do they stay well? So, really walking them through all 5 of those sessions. Uh, and I think the experience that you share is much the same as what many of our helpers have experienced is sometimes just teaching people how to breathe,
Mhm.
right?
Yep.
And going back to that, oh, I guess I'm just not taking deep breaths. Um, of all of the four strategies, which one do you think has the biggest impact?
It's the breathing.
It is the breathing.
Yep.
Yeah. Managing problems?
That one does for one of the people I worked with
Okay.
because they were expecting something to change that they had no control over.
Oh, sure.
So that was hard for that person to understand. So
Sure.
that one was a big one for one. And
Yep.
then the get going, keep doing was a change for another one.
And I think that's also the beauty of PM Plus is the the clients, the people that we're working with, uh, they can really decide which of those strategies can be most helpful for them based on the circumstances that they're facing in their life at that point. And they also then have those strategies that they can apply really for the rest of their life,
Hmm.
right?
Yeah.
Um, and not a program that was created here, a program that was created by the World Health Organization, and we know is working in up to 20 other countries across the globe. And you were part of the first cohort in bringing this work into the United States as the second place in the nation to be working collaboratively with the New School for Social Research. So um, you also then were part of now the Hope Haven training because Hope Haven, the peer support specialist, because those are the staff,
Yep.
correct? So certified peer support specialists receiving PM Plus training, and from the model that you and I were taught in that 12-week, 2.5 hours a week, now down to a 4-day training. How about the impact for the peer support specialists at Hope Haven? What have you seen?
It's huge. And I feel like it's a stronger learning experience and like they took more away.
Okay.
And I feel like it was easier for them to comprehend because they applied the skills right away.
And the training itself has changed so that those who are in the training get to observe.
Hmm.
One of the things that changed most dramatically was observe what it is to see two people in not a scripted way interact with one another using the strategy, and then they get to practice.
Exactly.
And I think to be able to do that, and then of course being at Hope Haven, they're already seeing people coming in regularly.
Exactly.
Have you heard any experiences from the peer support specialists in which they talk about the impact that they think PM Plus could make with the guests, right?
Yes.
The guests
Yes.
at Hope Haven.
Well, we already feel like we're using some of the skills already
Oh,
because, like, we'll use the breathing with people over the phone and we'll sometimes start doing the breathing ourselves to,
sure.
like, get ourselves and get them start using the breathing. And then we talk to them about the breathing.
Right.
And then sometimes we're doing the problem management part of it, the problem solving with some of the guests.
Sure.
And then so we find ourselves already using the skills. So we're actually looking forward to when the guests come in that we can put all 5 pieces together
Oh, sure. Sure. So when they call
over the
the
phone.
warm line,
Mhm.
what you really are doing is the peer support specialists are actually using the training
Mhm.
in a way that's almost sort of a prelude or a teaser
Yes.
that if you come in, I can teach you this face to face,
Mhm.
right? And I can walk you through these 5 sessions. The other thing that you bring up, I think that's important, um, is the impact that PM Plus has for those of us who are helpers.
Mhm.
Can you talk about as a helper? Do you use these strategies?
Oh, yes, definitely.
Yeah,
Because it helps me on my day-to-day stress as
sure.
well.
And if you had to think about um, your top two, mine is definitely breathing, knowing that the mindful managing stress. And then sometimes I think about the whole get going, keep doing, because sometimes I don't know that I really have the energy to do what I might need to do. So I've got to get out of my inactivity. Um, how about you? If you had to pick your top two?
It would be the breathing and then probably the managing problems because I run into unique circumstances all day long. I'm like, well, this doesn't fit into the policies anywhere. So then I have to brainstorm solutions and come up with how I'm going to approach this problem. So I use those two probably the most.
And starting the whole managing problems and listing all of them out, listing all of your problems, and then what's under your control, what's solvable,
Exactly.
and what's not solvable. And I think for so many people, just that first step of, yep, I see that this one, first of all, people will think that they'll need two pieces of paper to list all the problems. And it really ends up usually being six or seven things.
Mhm.
And then just taking off the list. If I really can't have an impact on it, then I just don't need to worry about it right now. Right?
Exactly.
Yeah. So if you were to think about what could be the impact of PM Plus in the peer support network, in people with lived experience, in people's recovery, if you could dream big, where would you see that PM Plus could actually go? We're only at the beginning.
Yeah, I think it's huge because I could see this impacting so many peers and go nationwide with just peers in recovery. Like it could go to different tribal peer support groups. It could go to different peer respites across the country and use this as skills in their toolboxes as well.
Sure.
There's just so much potential for peers to be using this and helping other peers because there's so many peers in the workforce that most people aren't aware of.
And to give them tools. And I think that part of the power of PM Plus is that they really are very specific strategies that you can teach people because we all want to be supportive.
Mhm.
And it's being supportive and teaching.
Mhm.
Teaching them something that they can then, after they've had their 5 sessions, they can just go out and they can become their own helper.
Exactly.
Yeah. Which is pretty close to the work of peer support.
Mhm.
Yeah. Yeah. I I see that. And so um your future and your continued involvement, how would you see this fitting into NAMI?
Well, we're already starting additional support groups with tribes and such.
Okay.
So, and the working with those tribes, I'm talking with them about like PM Plus. Would this be a good fit for you as well? And they're like, well, let's start the peer support group and then let's have for additional conversations. So I'm looking at other opportunities like as we grow, how PM Plus could also be useful in those communities as well.
And so peer support, is that is it one to one or it
Those are group ones.
oh, okay.
But they also do it one to one on those tribes.
Okay. So there is such a thing as group peer
Mhm.
support. Groups
Yeah,
of people get together.
yep. And our affiliate does group peer support right now, but the tribes we're working with are doing group peer support and one to one peer support.
And so NAMI in Wisconsin, you're the executive director. Is that all counties or
We cover 3 counties: Ashland, Bayfield, Douglas counties,
and tribes?
and the tribes within those counties or near those counties.
Okay. That's a large population.
Hmm.
Yeah. And so in that role as the executive director, you're really kind of the glue that is holding all of those
Pieces.
pieces and parts together.
Yes.
Yes. And so what do you do for balance?
Well, I have hobbies that keep me busy.
Yes.
And so I make greeting cards to keep me, when I'm feeling stressed out, I got to do something creative
Yeah.
and color and do things like that that are relaxing.
And your cards are incredibly beautiful. Chrissy, I want to thank you for taking time today. I know how busy your schedule is, and I know um, your passion and your drive for somebody with lived experience to have the sense of hope and forward thinking, and that you are so invested in the work that you do, not only with NAMI, not only with Hope Haven, not only as a peer support specialist, now PM Plus, now an advocate of Archimind, the work that Miller-Dwan Foundation does. Um, it is incredibly impressive, and so thank you so much for taking the time today.
Thank you.
That's it for this episode of The Force for Good. I want to thank you all for joining us, and please join us in being a part of The Force for Good.